So vaginismus is a condition where there is involuntary muscle spasm that happens as a result of any vaginal examination or intercourse. It's classified as primary and secondary. Primary, where the cause is not known. However, secondary causes could be related to multitude of conditions where previous history of sexual assault or any inflammatory condition like endometriosis, or there could be vaginitis or any infection that has stimulated some abnormal contraction of some muscles. The muscles that are commonly involved are the puborectalis, pubococcygeus, as well as levator ani. And these are the muscles at the entrance of the vaginal wall that involuntarily contracts when it comes in contact with anything like a speculum or tampon use or during sexual activity, and results in horrendous and excruciating pain, resulting in fear of further intervention. So it is a diagnosis that is initially presents itself around age 20, when women start having sexual intercourse, or earlier when they start using tampon. And usually they will find that it is difficult to insert a tampon or anything inside the vagina, because there is involuntary contraction of the muscle resulting in pain in the vagina, in the hypersensitivity in that area. There is a classification where there is grade 1, grade 2, grade 3, and grade 4. Grade 4 is considered a condition where there is just a contraction of the muscles at the entrance. However, it is said that the muscles is relieved with reassurance. Grade 2 is when the spasm is present, but it is maintained throughout the layers of the pelvis. So it is involving all the muscles of the pelvis. Grade 3 is when there is elevation of the buttocks and there is closure of the thighs and avoiding an examination because of the involuntary contraction of the muscles. Grade 4 is where there is closure of the thighs and refusal and retraction of the examination. So there is a retreat from an examination because of psychological impact as a result of previous examination. So they completely avoid the examination and they come out of the situation and they want to avoid that examination anymore. And this is as per Lamon's classification. There is another classification by Pasic as well, where the patient has nightmares, palpitation, tremors, shaking, nausea, vomiting, loses consciousness, but when they think that there is going to be an examination. So there is a big psychosexual impact as a result of the triggers that has happened from the past. So as I previously alluded, it could be primary cause where the cause is not known, but there is hypersensitivity of the muscles resulting in involuntary contraction, leading to pain during any examination. Secondary causes could be because of multiple causes. So this could involve previous chronic pain conditions, previous history of sexual assault, poor experience in the past, or negative emotional reaction to any sexual experience in the past, and having also conditions like endometriosis, vaginitis, or any inflammation in that area, or previous surgeries like an episiotomy or a vaginal tear there, where the suturing has happened and led to a scarring, leading to nerve damage, resulting in hyperesthesia and hyperactivity of the muscles. It is considered, the literature quotes that the incidence is around 0.5% in a general population. However, a Swedish study alluded that the incidence could be up to 5 to 6%. However, it is more commonly seen in women who have psychosexual problems, which can range from 12% to 40% in women presenting to gynecology department with similar symptoms. So treatment is multifactorial, and there is need to be a multidisciplinary input, and hence it is so important to have targeted treatment. There are so many things that has been said. However, some of them works better for someone and some works better for others. So there is a recommendation to use lubrication at the time of sexual intercourse or any examination, and use of vaginal dilators has been suggested. Also, there has been more evidence to suggest that naturally increasing lubrication by increasing foreplay can help. Also, there is a referral that we could do to pelvic specialists or occupational therapists who can assess the pelvic area to see if there is any trigger point as a result of the examination, and suggest treatments like biofeedback and electrical stimulation as well. There is also a discussion whether Kegel's physiotherapy can help, but again, it has been suggested that once the physiotherapy is started, some muscles can become more overactive on top of what is also hyperactive muscles. Hence, muscle relaxation therapy may help in some women as well. And overall strengthening in the muscles in that area might help instead of allowing few muscles to be involuntarily contracting. So that's the whole essence of physio. And some suggest diaphragmatic breathing, which helps to relax the muscles in the pelvic area. And also currently there is no evidence to suggest that Botox, which is botulinum toxins, have been suggested, which may help relaxing those muscles, which has good evidence in some other areas where muscles are very hyperactive. And last but not the least, anxiolytics and antidepressants and lignocaine injections could also help.